I want to tell you something about this journey I made for the last 8 years, together with my wife, Ronnie. We started a new company, and it was not just starting a company. For me, it was as a community nurse, I wanted to start a movement which would make the healthcare and elderly care in Holland better. Because as being a community nurse, after my study economics, I think this is the most beautiful profession you can have. But it was disturbed in many ways, I will tell you. So that was the reason that I said we have a lot of bureaucracy, and a lot of bureaucracy which is disturbing good solutions. So that's the reason that I called it humanity above bureaucracy. If you look at what Buurtzorg is at the moment, we can say it's a new organizational and a new delivery model. My ideas about organizing are quite different than what I learned at the MBA study. I didn't finish. No, I didn't finish a lot of studies. But I learned a lot from it. I started in 2007 with 4 nurses, with the 3 colleagues, just in one team, trying to go back to the principles of the World Health Organization on community-based integrated care, which I think is a very good model. At the moment, we have 9,000 nurses in 800 independent teams working all over the country. And what's very special is that we have only 45 staff people in the head office. And we have 15 coaches, so we don't have management. So it's just the teams and me, which is not really needed. Because I'm traveling a lot in a lot of countries at the moment. And we are serving 70,000 patients a year. I'll tell more about what type of patients later on. Then we have a turnover of 280 million euro per year, and we have just 6 people at the financial administration, and we don't have a CFO. So if you keep things very simple, then you don't need so many people to control all these things. So, and these few years of studies of economics helps that I can do it in 2 hours a week. So I don't hope I have offended some CFOs at the moment. One of the most important reasons that I started with Buurtzorg was because of the increasing bureaucracy. In the 19th in Holland, healthcare, and especially community-based care, was defined as production. Before that, we worked as community nurses, just trying to solve problems. And then at a certain moment, it was production. And we developed 10 different products. It was called personal care extra, personal care special. We had nursing care special, nursing care extra, guidance extra. It still is, for a lot of commissioners in Holland, it's the way they buy care. We want to buy so many hours of this and so many hours of that. And it's really disturbing the relationship with patients, between patients and nurses. And it led to a lot of fragmentation between cure, care, and prevention. The assumption was, when we create these incentives, these market incentives, and we call it products, that the quality would rise and the costs would go down. But the opposite happened. So the costs went right up. So we are the second country in the world with the most expensive healthcare system. And the quality went down. A lot of nurses quit their jobs because they lost their autonomy. They have to follow all these regulation protocols and so on. And they've lost also their craftsmanship. What I liked a lot about community nursing is that in every situation you can find in some kind of a co-production with the patient what's the best solutions in this situation. And that's got lost because of all the different products and protocols. And we got, when we look at the demographics, and I think it's the same in Great Britain, when we face the coming 20 years, we got a lot of problems with getting enough young people in healthcare. So we should make it more inspirational for young people. Clients, because of these many products, clients were confronted with a lot of different caregivers. So there was one in Amsterdam, and he put all the names on one of the doors in his room. And during 1 year, he got 150 different caregivers and nurses coming at his house. And there has been research that when you are regularly you get more than 7 people at your house, you lose control. So, and I think one of the most important things is that we empower people and give control to people. And then we spent billions of euros, billions of pounds on elderly care, and we didn't have any information about if this money helps solve problems. So what we only knew was how many hours care we were giving, but not if it was solving problems. So that were a lot of reasons to start this new organization.